Welcome to the Med Matrix podcast, where we talk about everything functional medicine. Today's episode is called Still Tired on Thyroid Medication. Learn what could be missing. We've been looking forward to talking about this one because it's something we see all the time. Patients who are taking thyroid medication are being told that their labs are normal, but still feel exhausted. They feel foggy, inflamed, or just they're metabolically stuck. So I'm excited to be joined today with one of our lead functional medicine providers here at MedMatrix, Dr. Sasha Rose, who's going to break down what patients should actually understand about thyroid medication, thyroid labs, fatigue, metabolism, basically all things thyroid, how functional medicine looks at what might be missing when symptoms are just not improving. Just as a reminder, before we get started, this episode is for educational purposes only. This is not meant to be personal medical advice and should not replace care from your own medical provider. If you're interested in receiving personalized medical guidance from one of our providers, we're happy to help. You can go to our website and just book a discovery call to start the process of becoming a patient here. So, Dr. Rose, why don't you just give us a brief introduction of yourself?
Sure. My name is Dr. Sasha Rose. I'm a licensed naturopathic doctor and acupuncturist. I am one of the lead providers here at MedMatrix. I've been practicing functional medicine for over 20 years. I am a published author, and I sit on the Forbes Health Advisory Board. I will say that thyroid health and optimizing thyroid health is something that I do every day. It's just a crucial part of metabolic health, women's health, men's health. I think that there's so much we can talk about with thyroid, and this podcast is on kind of thyroid medication in a great way. We're going to touch on, like you said, all things thyroid, and we could probably have 4 separate podcasts on thyroid and all the different elements to it. So yeah, just to kind of our listeners and our viewers, it's just, this topic is just kind of, there's so many layers. And so we're going to kind of do the best we can on it, but just know that we've done other podcasts on thyroid health. I know we're going to do more. I know whenever I post anything about kind of, a clinical anecdote from my own practice on thyroid health, I get so many comments, so many kind of, so much interest, I guess I should say, because I do think it's one of those aspects of health that unfortunately conventional medicine kind of is kind of a one-track mind. And there's usually just one way to go for the most part. That's a general statement. Whereas in functional medicine, we really do take quite a nuanced approach. So it's a great example of that.
Wonderful. So before we even get started here, can you just explain to us what the thyroid even is, how it functions, what it does, and why we should even care about it?
Yeah. So again, we're really talking about, specifically in this episode, we're talking about thyroid medication. So if someone says, I've been on a thyroid medication, I've been on it for years, I don't feel any different, I still feel tired. The main thing, and I just kind of alluded to this a little bit, is that the thyroid, they might be on the right medication, but it's most likely just one piece of the plan. There's so many different reasons why somebody is fatigued. There's just so many. And so persistent fatigue can mean that something is missing. Maybe the thyroid medication does need to be adjusted, but there's just a lot of other things that go into our health, including our energy level. So specifically about the thyroid medication, maybe it's about the medication absorption. Maybe it's the dosing, the timing on how they're taking it. We will talk about conversion of T4 to T3. Maybe there's some nutrients are missing, so that conversion is less than optimal. Maybe there's inflammation systemically in the thyroid. We'll talk about autoimmune Hashimoto's and other types of inflammation that can affect the thyroid. Maybe blood sugar is off. Maybe the gut health is off. Maybe the stress level is like through the roof. Sleep is off. Hormones are off. There's so many things that can affect thyroid function. It's not just like you take the medication and everything goes away, because we're just more complex than that.
Interesting. So one of the things that comes up a lot is thyroid's connection with energy, but why is thyroid health so connected, or so much more than just energy?
Yeah, and it's true. Like oftentimes I think that's what we know about thyroid is like you're tired and maybe it's your thyroid, and maybe it is. But thyroid hormones influence additionally, it's very broad. I would say metabolism, temperature regulation. There's an impact even on digestion, definitely mood. And I think one thing that people usually know is the connection with hair and skin quality, brain function, so mental function, brain function. There's even, for our female patients, there's even a link with menstrual cycles, cholesterol, body composition. I think people know that one. And just even on a cellular level, how the body is using energy. So pretty complex.
So, I mean, it does lots and lots.
It does lots. It's multisystemic, meaning it affects multiple systems within the body, not just if you're tired or not.
So with that said, like, what does thyroid medication usually do, and why might symptoms still remain while taken? You touched on it a little bit, but like, why specifically?
Yeah, so the idea with thyroid medication is that it's basically thyroid replacement. So the idea is that your own thyroid gland is working suboptimally and not producing optimal levels of the needed hormone. And so we replace it in order to kind of support all those systems, support metabolism, support brain health, all the things that we just listed, to kind of bring back support to all of those parts of the body. So a thyroid medication is designed to basically replace the thyroid hormone. The standard ones, things like levothyroxine and Synthroid, are T4. And T4 is basically the inactive form of thyroid hormone. The body has to absorb it, convert it, transport it, use it in the form of T3. And that is the one that actually kind of locks into the thyroid receptor and does the action. But what we're taking, T4 has a longer half-life. And so usually that's the one that's given because it lasts long enough to circulate. If any part of that process, again, you take the T4, but if any part of that is kind of hindered or inhibited in any way, the patient may still not feel great.
Okay, that makes sense. So, I mean, continuing on with that, can you name 3 reasons thyroid medication might not be enough just on its own?
Yeah, so any medication that is kind of taken orally requires optimal gut absorption. So that's one of these 3 reasons why whatever you're taking, whatever thyroid medication you're taking, might not be enough on its own. So if absorption is poor, you're not going to get the most out of your medication. If you're having an issue with that, again, that T4 to T3 conversion, that's a reason why the T4 medication might not be enough. If there's an autoimmune component, so if there's elevated thyroid antibodies, people I think know the term Hashimoto's, or some of our listeners might know the term Hashimoto's disease, that needs to be addressed, that kind of autoimmune picture. If there are certain nutrients that are required for that to kind of feed the thyroid, specifically to feed optimal conversion of T4 to T3. If that's lacking, your conversion is poor. Yeah, you can have a lot of inactive T4 circulating, but you're not getting the final product. So that's probably 3 right there. There's additional things that can kind of contribute, but those I think the conversion one is probably the biggest.
Okay. I'm sure that's helpful for people. So why does it matter if a patient is still symptomatic, even when their TSH is normal?
So TSH, just again for our listeners, stands for thyroid stimulating hormone. This is a hormone that is secreted by the pituitary gland. Pituitary gland is kind of like the mother director up here. And the TSH basically tells the thyroid to produce T4. And again, we're mostly talking about medication today, but in terms of kind of labs, usually TSH is the one that is tested. Like usually if somebody says I've had my thyroid tested, that's usually the only test that's been done. And it's usually, and we do use it to gauge when somebody's on medication, we gauge if it's the right dose or not. So that's why TSH kind of is important. Somebody's put on a medicate like a levothyroxine, a Synthroid, something like that. They still feel tired. They go, they get their labs drawn, they get their TSH drawn, and they're told you're normal, but they're not feeling normal. They feel pretty tired. So a normal does not always explain kind of how they're functioning. If they still have fatigue, brain fog, their weight hasn't changed, the temperature issue, like they have cold intolerance, maybe they're constipated. Ideally, there's more discussion, right? There's more that needs to be done. There's more labs that need to be done. And as we talk about a lot on this podcast, is that TSH really optimal, or is it just within normal? The conventional reference range is much wider for TSH than functional medicine. We really like to see that TSH range being, we usually say somewhere between 0.75 and 2 on the labs, and that tells us that the thyroid is not just kind of struggling, but actually doing quite well. So it's more than just that one test result.
So in like a lot of instances around here, it's about optimal levels, not normal reference ranges.
Correct.
Got it. So we've been talking a little bit about symptoms. So why is it that thyroid symptoms can affect someone's quality of life so deeply?
Well, I think we've probably all had some time in our life for one reason or another where we've just been exhausted. And so when somebody's thyroid function is not optimized and they're having thyroid symptoms, it really can affect everything. And I would say that fatigue is probably the primary reason. If somebody feels exhausted, it's going to affect everything, right? It's going to affect mental health. It's going to affect physical health, emotional health. If they're cold all the time, if they're inflamed all the time, their weight feels like it's out of control. They're not going to have the energy to eat well, to even be motivated to cook healthy meals. It just can kind of affect everything. And so in terms of, socially, it's going to affect how you interact with people. It's going to affect your work, your relationships, how you feel about yourself, obviously your mood. So if the thyroid is really off, it's kind of a big deal.
So what are because we were just talking about symptoms, what are the 5 top symptoms people may still have even when their thyroid labs look normal?
So 5 symptoms that I would say people will often have, even when they're told that their thyroid labs are normal, is the fatigue, which we've talked about, brain fog, which is a little bit different than fatigue. Brain fog is often difficulty with word recall. It often will show up at work or in, job situations where people just don't kind of feel like they're as sharp. They can't kind of keep up with the rest of the group at a meeting. Definitely weight changes. So we are talking about hypothyroidism, so a sluggish thyroid. And that often, for most people, means that they're gaining weight despite, not changing how they're eating, or even maybe they're still exercising just as much, and yet they just keep gaining weight. So we have fatigue, we have brain fog, we have the weight piece, cold hands and feet. So that's that temperature regulation. And then I'm going to say, in terms of what I see clinically, I would say probably hair loss is probably at the top there. Additional ones, those are, I just kind of picked the top 5, meaning the most common. We will also sometimes see slowed motility in the gut, meaning constipation, low mood, bordering on depression for some people. Dry, I did mention skin earlier, dry skin. In terms of how it can affect a menstrual cycle, sometimes the periods are heavier. There are thyroid hormone receptors in the muscles. Sometimes you have kind of what we call myalgia or muscle aches. And just, most people know their bodies and they will feel like things have just overall kind of slowed down. They might not call it like a metabolic issue, but that's essentially what they're feeling, just slowing down.
So with the idea of people kind of being in touch with their own bodies in mind, could you speak a little bit about why thyroid care should be personalized instead of just treated like a one size fits all prescription based on what's normal, ranges, etc.?
Yeah. I mean, I alluded to this earlier, and it happens all the time. I would say maybe especially around thyroid health, where there's like one option. There's one test, the TSH, there's one prescription, levothyroxine, and that's kind of the end of the discussion. So I feel pretty strongly that all care, including thyroid care, really does need to be personalized rather than, as you said, like a one size fits all prescription. And we are all different. People come in with different symptoms, different health histories, their labs are different. Our comprehensive panel that we offer every new patient and that I will repeat as I'm monitoring somebody's thyroid health is a full panel. So it's not just the TSH, it's a T4, it's a T3, it's 2 kinds of thyroid antibodies, and even another one called reverse T3, which kind of completes the picture. The gut piece, right? How well is this person even absorbing the medication they're taking every day? How well, if it's Hashimoto's or not Hashimoto's, there may be an issue with that conversion that I talked about. People in general have a wide range of sensitivity to medications and tolerance. And it's something I ask every new patient is, do you react differently or strongly to new medications, supplements? And I think it's something that every prescriber really needs to know, because we are not the same biochemically, and you can't just throw the same dose at every single person and expect the same result. People, have different levels of stress. That's going to play a role. The other hormones, so the sex hormones, cortisol, insulin, that's going to play a role. So as you can tell, I feel pretty passionately about that one.
So at the end of the day, there's lots and lots of reasons why everyone shouldn't get the same dose, be doing the same thing. And if that is the case, like you are and all your girlfriends seem to be on the same dose, might be worth questioning why. Like everybody in your social circle is taking the exact same dosage. Based on what you said, it'd be a reason to be like, well, it's kind of weird.
Yeah, and it's not just dose. It's like there's not just levothyroxine, right? Like there's other forms there's brand names of that levothyroxine, which is the generic, and some people do better on some of these brand names. On paper, it looks like it's the same. It looks like it's T4. But I can tell you time and time again, people don't tolerate one, but they tolerate another. There's natural thyroid replacement, which is both T4 and T3. And it takes adjusting. It takes testing and seeing how they're feeling, and you kind of go back and forth till you get it right. But I really like letting people know that there are options, and give me time and we will try something. And if that doesn't work, we'll try something else, rather than there's one option. And that's, like we said, it's just not a one size fits all.
So it's almost like adjusting a recipe to some degree.
Yeah, exactly.
In another human being, though.
Right.
Okay.
So, and as long as people know that from the start, and that they know that I'm going to expect communication, and you're going to tell me if this is better, not better, and I match that with the lab results. Not always, but we usually can get pretty close to optimizing the thyroid.
So as far as like this is better, that's better, that sort of thing, I guess, what are you hearing, or what are the 5 things that can make someone feel tired even if they are taking thyroid medication?
So, yes, and this is a really important question. So 5 things that will make somebody feel tired even if they're taking thyroid medication. As we discussed, there may be a gut issue, so there might be poor absorption. The whole conversion thing, basically, just to get into the geeky details a little bit, is T4 is what the thyroid produces, or it's what you're taking as your medication. It travels throughout the body, and there's a specific enzyme that lobs off one iodine molecule. And so you go from 4 down to 3. So that's the T4 to T3. Now you have the active or the bioavailable T3. That's a really important enzyme, and that's a really important piece. And that's where you need optimal nutrients, things like selenium and iron and zinc, a lot of the B vitamins, D, like all of these things are like optimal levels of those are required for that conversion to happen. So you can, again, be taking your T4. If you don't have these other cofactors, these other ingredients, it's kind of like your analogy with the recipe. You might have like the highest quality flour in the world, but if you don't have the baking soda and the eggs and the butter, you're not going to end up with very good cookies or whatever you're trying to get in the end. So, yeah. So basically, those things are sometimes missed. So, somebody still might be tired if the absorption's an issue, if the conversion is impaired, if they have the autoimmune form, which is Hashimoto's, if their vitamin D is low. Again, that's a really, really, really common, especially where we live, and that's an important cofactor for that conversion. So those are, I think, 5 things. Other things can include chronic stress, blood sugar, inflammation, other hormones, as we mentioned earlier.
You've mentioned absorption a lot there. So what are some things that can interfere with thyroid medication absorption?
Yeah, so there's a lot. There's 3 important things that really do interfere with thyroid medication absorption. And this is why we tell our patients, and they should have been told this kind of by any provider, and usually they are, or by the pharmacist, that you really need to take your thyroid medication at least 30 minutes away from any food. You don't take it with other supplements. You don't take it with other medication. So things that can interfere with the absorption of thyroid medication include food, coffee, calcium, iron, fiber, as I mentioned, other medications. So those are the, and also just being inconsistent. If you kind of take it in the morning one day and then you take it at night the next day, that's going to have an impact as well. And then just overall kind of digestive pieces like, if there is an issue with your stomach acid, if there's kind of some kind of inflammatory intestinal condition, that's going to decrease the absorption of everything, including your thyroid medication.
Wow, I mean, there's a lot to consider there.
Agreed.
People need to know to take this medication.
Yeah.
So we touched on this a little bit in the beginning, and usually when people think about thyroid, they think about thyroid medication. Usually Hashimoto's comes up in the conversation. So how can Hashimoto's and or thyroid antibodies change this conversation?
So Hashimoto's is the same thing as autoimmune thyroiditis, and it's an autoimmune thyroid condition. I believe it is the cause of maybe I've heard anywhere from 75 to like 85% of hypothyroid cases. So it's by far the majority of the reason or the cause of hypothyroidism, but it's not always the cause. Now, if you are just getting your TSH checked, even if you're just getting your free T4 and TSH checked, you're not going to know. There's really no way to know if you have Hashimoto's or not. You really need to have thyroperoxidase antibodies and thyroglobulin antibodies tested. And some doctors are more willing than others to do that. It's not something that insurance covers, and so that gets in the way in kind of a conventional medical practice. If you have Hashimoto's, if autoimmunity is part of this picture, you have to, in my opinion, you have to kind of address that as well. It's not just, again, throwing one medication at it. You need to look at overall kind of immune triggers, gut health. That's a whole other podcast topic of the connection between the gut and autoimmune conditions. Again, nutrients. It's often, it's not only, but it's often in Hashimoto's when that conversion, people have difficulty with that conversion of T4 to T3. So looking at the big picture of why there's an autoimmune process going on should be part of the conversation.
So you mentioned nutrients a little bit there. What are 5 nutrients that matter for thyroid function and for energy? Yeah,
so 5 nutrients that are really important for both thyroid function and energy would include iron and selenium. I think I mentioned that one earlier. Zinc, iodine, and vitamin D. Did I get 5? Iron, selenium, zinc, iodine, D. Those are pretty crucial. And so, we can test levels of iron. We also, ferritin is kind of a better indicator. It's your storage of iron. That's kind of a better actual test of what your iron levels or stores really are. But we can test for all of those nutrients, and that can kind of help us again with that nutrient picture, and not just kind of randomly throwing things at a person, like having actual data.
So we're on nutrients here, so it makes sense to ask. I mean, why, you touched on this a little bit, why can gut health be such an important part of the thyroid conversation?
Well, if you're taking, so say you test for these things and you know that you're low in zinc or iron or whatever, and then you retest and there's no change. If you have an issue at the gut level, again, there's inflammation, there's that's not the best term, but it's called dysbiosis, right? Like your microbiome is off. You're not going to be, you're taking the highest quality, the most expensive nutrients. If you're not absorbing them, they're not really, that's kind of pointless. So that really has to be part of the picture. So if gut health isn't addressed, then you're potentially not fully optimizing the thyroid. It's going to affect your immune function. Again, it's going to affect your level of inflammation kind of systemically. And if there's kind of any piece of that, if digestion is impaired, if there's reactions to food, if there's gut inflammation, the person, again, maybe on paper is taking the appropriate thyroid medication or treatment, but it's kind of not going anywhere, or it's not going anywhere enough.
So in terms of like the difference between, conventional stuff and what we do, where does conventional thyroid care often fall short for patients who still might feel tired?
I would say, just based on what I see clinically, is that, and this is just largely, again, what I'm hearing from patients, like who they've seen, like what has been done or not done, and before they come and they sit in my office, is that conventional thyroid care will often fall short for a lot of people with hypothyroidism. Again, often these are the ones that come in with pretty significant fatigue. Maybe they've had their TSH, their thyroid stimulating hormone, checked. Maybe they've been given some medication, and then the TSH is rechecked and they're told everything looks fine, yet the person does not feel any better. Their energy has not improved. So what's usually missed, and this is not because a specific provider doesn't care, we always like to point out, it's really the system, it's not an individual provider, is that there's just not whatever the time or the insurance reimbursement for these kind of deeper dives into why the fatigue, why is the conversion optimal? Does this person actually have Hashimoto's? Are their antibodies elevated? That's not usually tested for. Maybe endocrinology. Endocrinology might, if they get referred because nothing's getting better, they might have those antibody levels checked. What's the nutrient status? What's the gut health? What's like overall metabolic health look like? It's just not really part of the conversation in conventional thyroid care.
So with that said, what are the three thyroid markers patients should know beyond TSH?
Yeah, so we on our panel, and I really get a lot out of the panel because it's, I think, pretty comprehensive. We have free T4, we have free T3, we have the thyroid antibodies that I mentioned, and there's actually two different ones, thyroglobulin and thyroperoxidase, and then reverse T3, which basically is kind of an inactive or an inert competitor to T3. So when that is too high, it's basically it's taking up those receptor spots so that the T3 can't lock in. As you can see, that just paints a much more comprehensive picture than your TSH.
Yeah, I mean, that makes sense. And, we've been discussing some markers here. So how does functional medicine approach thyroid symptoms differently or just care?
I would say that in general, functional medicine approaches thyroid symptoms, thyroid health, really by looking at the whole thyroid pathway. And as we've discussed, kind of all the systems around it, all the different systems that influence it. And so that's going to include the other hormones, that issue of conversion that I keep coming back to, the antibodies, the nutrients, the gut health, the inflammation, the blood sugar, stress, quality of sleep, quantity of sleep, even your liver function, other medications, and just kind of overall lifestyle. So as we do with every aspect of care in functional medicine, we really are taking kind of like the whole person into account, and really not just looking at this one individual lab value, this one individual gland or symptom, but really realizing that it's all part of this bigger puzzle.
So you touched on it a little bit, and we've mentioned some labs throughout the chat here, but what thyroid labs or markers may help create a fuller picture for patients and for you?
Yeah. So just to repeat, the thyroid labs and markers that really do, I think, create a fuller picture include the TSH, the free T4, free T3, the thyroid antibodies, the reverse T3, iron and ferritin, vitamin D, your B12 level, potentially even levels of zinc and selenium. Those ones I don't routinely check, but if we're really kind of stuck or frustrated or not really figuring out why someone's not getting better, those are certainly indicated. Inflammatory markers, blood sugar markers, so that would be like your fasting serum glucose or your hemoglobin A1C. And everything we do is personalized. So I'm not going to order the same labs for every single person with hypothyroidism. We, depending on their specific situation, we will do certain labs and we'll leave other ones out.
So with that in mind, I guess, talk to us a little bit more about how you think about, normal versus optimal in thyroid care.
So, yeah, I mean, we talk a lot in functional medicine at MedMatrix about normal versus optimal in terms of the labs in general. And I always say that the thyroid levels, especially the thyroid levels, and even more specifically the TSH, is just a really good example. As I mentioned earlier, TSH, like on a regular lab reference range, anything between 0.5 and 5 is considered normal. And so that is inside the reference range. That's considered normal. person does not feel well, right? They're tired, like I mentioned earlier, all the things, hair is falling out, etc. We look at, just in terms of that specific test, we have a much more narrow reference range. So the general rule of thumb is somewhere between 0.75 and 2, so narrower on either side. Now, again, we're also looking at the symptoms. We're looking at patterns. We're looking at trends. We're looking at kind of overall metabolism and mood and daily function. But that test is, I think, a really good example of the whole normal versus optimal difference between functional and conventional care.
So here's a question about, how we treat patients here. When someone comes into MedMatrix, still tired, they're taking thyroid medication, where does that process begin for them?
So when someone comes here to MedMatrix, they have been put on a thyroid medication. They're taking their thyroid medication, and but there's, one of their chief concerns is that they're still fatigued. We are looking at the whole picture. So we're taking a full health history. We are asking about, the timeline of the symptoms. When did this start? What else was going on at that time? What other medications are you on? Some of our patients have had a full or a partial thyroidectomy. So the gland has actually been removed. We do a full review of the labs, and that's not just the thyroid panel. As we've mentioned, again, that initial panel is going to include metabolic markers, what's called a CBC. It's going to, a full hormone panel. It checks for kind of baseline autoimmunity. There's a lot in that. So the thyroid panel is a piece of it. Looking at nutrient assessment, and that's based partly on some of those tests included in that panel, and also asking the patient how they're eating. What's the gut health like? We're reviewing what supplements they are currently taking, if any. Asking pretty, I would say, probing questions in terms of stress resilience is the term I use, sleep, and as I mentioned, gut health. So it's a lot. And it's not just questions that seem, the questions might not seem directly pertinent to the thyroid, but they really are.
It's really a full picture
Absolutely.
Of like everything. So with that said, what might a personalized thyroid support plan include for a patient?
Yeah, so a personalized thyroid support plan at MedMatrix will include a medication review, and that's with myself or one of the other providers. A nutrient, making sure that those nutrient levels are optimal. We do talk a lot about protein, making sure that the protein intake is optimal. Blood sugar stabilization, gut support, and that can take a little time, but we get started on gut support. Same with stress and sleep. I think we all know that's not something that happens overnight, but we at least we get something in motion to start to optimize stress management, stress resilience, and optimizing sleep. We are talking about inflammation a lot and ways to kind of bring some of that inflammation down. Again, when relevant, talking about autoimmunity and how to help moderate that. So that's kind of at the beginning. And then we are doing, especially with thyroid, but usually this applies to a lot of things, but definitely with thyroid, there is a lot of ongoing monitoring, both in terms of labs and symptoms. So it's always a marriage. It's always a marriage of like, are you getting better? And what are the numbers look like? And it's, I really don't like to chase lab values, but I also don't ignore them.
That's an important distinction.
Yeah.
Actually, is not just treating a number.
Yep.
So, I mean, we've talked a lot and we've got about, I think, 2 minutes left. So what would be the biggest takeaway for someone who is still tired on thyroid medication? What do you want them to walk away with? Or maybe their loved one is.
Yeah. So really, I'm again, to see it as if we're kind of monitoring the progress or the process while somebody is on some kind of thyroid support plan. I am asking them about their energy. Has it changed? I'm asking them about brain fog. Has it changed? You know, if weight was part of the initial concern, I'm asking them about it, but we also have an in-body scanner, so I can actually have actual numbers and metrics to see for myself if the body fat has gone down, or if it's muscle that's gone down, or if it's water weight, like what specifically is contributing to this change in weight, not just a number on a scale. I'm asking if there's been any changes in digestion. Do they feel like they're tolerating, cold any better? Now, this can take a little bit of time, but hair changes. Is there more hair growth? Is the quality of your hair any better? What about mood? Are you sleeping any better? And then, as I mentioned, also just kind of like, matching that up with labs. As I mentioned earlier, everybody's different in terms of their sensitivity and reactivity to medications. So I have plenty of examples where, I tried a certain medication or a certain dose on a medication, a thyroid medication. They did not do well on it. And so we pivot. We're monitoring the blood sugar. Again, if I feel this is all personalized, it's all different for every person, but if blood sugar is a part of the picture, we're monitoring that as well. So we have blood sugar markers on our labs. We have inflammatory markers on our labs. And, is the person kind of getting closer to feeling like themselves?
That was excellent.
Great.
Explanation of what to look for, all of it. So thank you so much, Dr. Rose. If you're interested in receiving personalized medical guidance from one of our providers, we would be happy to help. You can go to our website, book a discovery call, and just start the process of becoming a patient. If you feel as though someone could benefit from this, please share, just so they can feel like they're not alone. Thank you, Dr. Rose, and
thank you, Brian.
I think we'll see you next time.
All right. Sounds good.
Bye.
Bye.